Hi, my name is Tina Zillman from Advanced Rejuvenating Concepts. I've been doing aesthetics for over 35 years. And in that time, we've really gotten away from the consultation of a client coming in. So today we're going to go over mapping of a client's skin. In mapping, we're going to point out a few details as to what a mature clientele is coming in for. So if you have someone that's interested in rejuvenation, mainly, that's what we're going to talk about today. We have our client here, and you can see by her skin that she's having some issues with just general aging. Aging is going to happen to everyone. What we need to do is give this client realistic expectations. What are they going to expect during their treatment? It's really easy to just say, let's do this treatment or this trendy treatment. People come in asking for what they see in the magazines a lot of times, but it doesn't mean that it's going to be good for their skin. So when I look at a skin, I look for a couple of things. I look for overall evenness of the skin. Do they have an even color to their skin? Do they have sun damage? So when you see these gorgeous people on the magazines, they could be 80 years old and they've got completely smooth skin. Most of them might have some signs of light wrinkling, but they're filtered. A lot of Photoshop has been done on these people. So this is what your client is coming in for. They don't recognize themselves a lot of times with these signs of aging. They want the aging gone. There's nothing wrong with having expression lines. I love someone with expression lines. I like a little movement in the face. So I will talk to somebody about, just kind of evening the tone, helping improve the pores, helping improve the fine lines. And so that's what we're going to look at today. Also, it's a head to toe now. People want head to toe treatments. They want their face to look like their chest, to look like their arms, to look like their legs, to look like their buttocks, to look like their breasts. They want you to do the treatment everywhere. And if you see some of the trendier treatments, they're talking about head to toe treatment. We have always talked about head to toe treatments with light skin peels. Light skin peels can be used everywhere. Hydration can be used everywhere. Back facials, buttocks facials. People are asking for these treatments, so you have to have a protocol for them. So when we take a look at somebody with mature skin, we're looking at a couple of things. We're looking at the modeled skin. Is the skin modeled? Modeled being, does it have a texture to it? So, I will just kind of lightly push on the skin, and you can see that texture of her skin. You can see these little frown lines here. They're kind of wearing in. A lot of times, if you can get these lines before they start wearing in and breaking down that collagen to soften, you won't have that line of running through that brow area. Another thing we're looking at is the sun damage and discoloration. Crow's feet, fine lines, porousness on the nose, on the chin. Is there expression lines staying? Is there lip lines, lead lines, lipstick lines? This is what we're looking for. Now what we're looking for is the neck and the décolleté. Do we have discoloration there? Don't leave out this area when treating. You should treat from here to here when they come into the room. So yes, she's got pigmentation, discoloration. If you want a steady flow of clientele, they have to understand what they're spending their money on. If they do not understand what they're spending their money on, they probably are not going to come back and see you. And so that's what we do with mapping. So very important that we look at that. So with Colleen's skin, I'm going to address the pigmentation. IPL, BBL, broadband light, intense pulse light, laser are the easiest way to get rid of a lot of this sun damage quickly. You could do it with light skin peels and microdermabrasion if you don't have access to a laser or a IPL unit. We could do a little resurfacing of her skin with a laser, but we're going to take it as we can do laser, we can do IPL. So we want to do several treatments. We want 3 treatments of IPL to help correct this pigmentation. In between that, I'm going to do a rejuvenation facial, which is a light skin peel to help with these spots coming off and flaking off. Some of these will stay because they're more like a dermatologist has to take a look at these. She's got some texture to this one on her shoulder. So I always recommend a dermatologist look at the client prior to starting this kind of treatment, because I want to see when they've been into the dermatologist last to have a full body scan to just check out these spots. I have caught basal cell carcinomas before the dermatologist has, and I'm not saying that in a way, I just see this client every single month. And when things come up, like there's a flaky spot on her lip, I sent her to the dermatologist. He said, probably nothing, but let's biopsy it. We biopsied it and it was a basal cell. So sometimes just the difference in the change of someone's skin from month to month can save them from that getting too large and it being really destructive to the area. She had it removed and she did well. Don't ever diagnose. Don't ever tell somebody that they have a basal cell. Don't ever tell somebody that they have a melanoma. That is not us. We are not doctors. We are not here to diagnose. We don't want to scare somebody. We just want to suggest there's a change in your skin, see your dermatologist. So do not do that. We can get in a lot of trouble diagnosing. So I just send them off to get these areas maybe checked up before we start. So with Colleen, we're going to address the pigmentation. As you see, it goes all the way down the arms, into the hands. Hands are big now. People want their hands treated. We will treat someone's hands. I'm just going to take this hand and put it right here. We will treat their hand at the same time that we are treating their face. They have spots on their hands. Hands tell their age as well. So don't leave out hands, arms, and décolleté area when you're treating someone for a facial. Talk about these areas. IPL can easily take some of these sunspots right off the skin. So we're going to start her with 3 IPLs. In between that, we're going to do light skin peel a week out. That's going to help these kind of flake off a little faster. It's also going to help the modeling of the skin. After that, we are going to assess the skin. Does she need something deeper? Does she need needling for the fine lines around her mouth area? Does she need needling for these crow's feet and up through this brow line? Does she need needling to soften? What needling does, if you can do it, is it ends up rejuvenating collagen and elastin. There is a radio frequency needling, and if you can do that in your state, that rejuvenates collagen, elastin, and hyaluronic acid because you're introducing heat to the skin. So in states that we can only do microneedling or say nano needling, it makes a big improvement because you're getting in there, irritating the skin. When you irritate the skin, collagen and elastin boost, and they kind of fill in these little lines. So we talked about mapping and looking at a client's skin, looking at the color, looking at the overall sun damage, looking at the pores, the fine lines, the wrinkles. But what we also need to do is take into consideration what this client is using. Is this client on any type of medication that's going to not allow us to do certain type of treatments? Is she using home care, like maybe Retin-A, that will make her more sensitive to our treatments? So in your clinics or spas or salons, you need to have a consultation page that goes over a few things. Are you on hormones? If she's on hormones, it's going to tell you. Or is she in menopause? Is her skin dry? Is it crepey? Is she losing progesterone in her skin? That'll tell you why she's dry. Is she on birth control? Birth control can sometimes make hair grow on the chin. It can make acne happen. It can regulate hormones sometimes, but also can break someone out. Are they doing pellets? Because pellets are new now to a lot of people doing them. Pellets or testosterone shots are kind of what women and men are now doing to give them a little more energy in their older years, to regulate their hormones. Pellets are actually placed into the backside of somebody and can cause hair growth, can cause dark hair growth on the chin, lip area for a female. So I want to know if they're on hormones, if they're on any replacements, if they're doing testosterone shots. That's going to tell me a lot about the hair growth. If they do have dark hair growth, you can do some laser or waxing or plucking or dermaplaning on that area. And generally that will not stop that dark hair until those hormones go back in, regulate, or they stop doing the hormone replacement. So we're seeing a lot of that. We are also seeing a lot of people come in and they're using Retin-A. Retin-A makes the skin a little bit more sensitive. So you hear stop Retin-A 7 days before you do a treatment like a light skin peel or microdermabrasion. But you have to also remember Retin-A is actually a prescription drug that gets into the bloodstream. So they're going to be sensitive no matter what. Just know that they're going to be sensitive. And maybe instead of a face wax, you do a dermaplaning. Maybe instead of a 30% glycolic, you go to a lactic peel. So that is what that question is going to answer for us. Obviously, we'll ask about pregnancy on here, your older clientele. Do you have hysterectomy? Have you had any type of cancer, breast cancer? We want to know all this because of, again, the hormones, because of the dry skin, because of the crepiness. It's going to be very important for us to know to map out their routine. Another thing that really has to be asked is how much are you in the sun? We'll have people come in, they'll have a white face and they'll have a dark body. They've been in the sun. So they protect their face, but they're not protecting their body. If you go ahead and do a lot of these rejuvenating treatments, they go back into the sun. Now they're burning baby skin. So you want to be careful with that. You don't want to give them peeled, exfoliated, brand new skin if they're going to go back in and not use sunblock and be exposed to the sun. We have a lot of people come in with pregnancy mask and pigmentation as well. That's another thing we want to know. And sometimes it's not from sun. Sometimes it's from heat. They work out, they do Peloton at home. They have an internal body temperature that heats up and causes melasma and pigmentation. So it's not always sun that's causing some of these brown spots, but it could be hormones and heat. So you have to really ask a lot of questions like that before starting a treatment plan like this. It's ridiculous to have somebody go off their anti-aging. If a dermatologist or a plastic surgeon has given them Retin-A, I will not tell them to go off their Retin-A. What I'll do is I'll adjust my treatment plan accordingly. So I'll just say, don't use your Retin-A for a couple days, 48 hours after we do the treatment, and then stop 48 hours before we do the treatment. I'll know that her skin is going to be sensitive. So like I said, I will choose a lactic acid versus a glycolic, a beta hydroxy versus an alpha hydroxy. If I'm going to do an exfoliation, I'll do a patch test first, but I certainly will not do any waxing on her skin. Retin-A does make the skin really delicate. And if you wax, you can tear the skin. I will do a dermaplaning on her skin though, just to get off that vellus hair or any dark hair that she wants. So that would be my choice. Other than that, there's not a whole lot else that really is going to alter our client that we're going to be doing for rejuvenation. But those are some important questions. Another question you want to ask is, have you done treatments? Are you under anyone else's care? Because we have had clients that are almost obsessed with rejuvenation, and they will jump from place to place to place to get what they want. Make sure you assess the skin. Make sure you look at the skin. Make sure you're acquainted with the texture of the skin and knowing if the skin is compromised. Knowing if the skin is red and irritated, you probably don't want to put an acid on there. Knowing if somebody's been over exfoliated or using too much product at home, you don't want to put an acid on there. So it's going to be very important that you know the skin before setting up a treatment program for them. And these questions on your questionnaire will be perfect. A lot of your insurance companies provide a questionnaire, but you should have one that's actually made for your spa, salon, or clinic.